Addiction is a form of learning that worked too well. The brain is built to notice what brings relief and carve a fast, automatic path straight back to it. Over time, that reward system becomes a rigid physical groove. Conventional treatments, like daily patches and pills, usually try to block the chemical cravings at the surface. They often fail because they don't address the deep structural rigidity of the underlying neural circuit. Data from recent clinical trials suggest these habits are less permanent than we once thought. The research indicates that a single, supervised afternoon can loosen a dependence built over decades. To genuinely break an overtrained habit, a medicine cannot simply block the drug. It has to give the brain a way to physically unpave the neural highway that demands it. In 2014, a Johns Hopkins pilot study took 15 people who had smoked for an average of 31 years. After taking psilocybin alongside cognitive behavioral therapy, 12 of those 15 were biologically confirmed smoke-free 6 months later, an 80% abstinence rate. This chart compares that 80% figure against the best traditional therapies, which rarely clear a 35% success rate. The signal holds for alcohol, too. In an NYU trial, psilocybin cut heavy drinking days from 24% to under 10%. This is a rediscovery of an old idea. A meta-analysis of randomized trials from the 1960s and 70s showed that a single dose of LSD nearly doubled the odds of a patient reducing their alcohol misuse. Those early findings were pioneered by psychiatrists in the 1950s, who hypothesized that a profound experience could mimic the psychological hitting bottom that occasionally led to sudden sobriety. Across 70 years and different molecules, the statistical signal is remarkably consistent. This persistence suggests a shared underlying biological mechanism is at work. That mechanism begins with the 5-HT2A receptor. Classic psychedelics activate this receptor to trigger a structural reconfiguration of the brain's physical architecture. This activation triggers a surge of BDNF, a protein that facilitates the growth of new synapses and dendritic spines on cortical neurons. Researchers call this class of neuroplastic molecules psychoplastogens. This growth mimics a critical period, a window of extreme brain malleability for learning that is normally restricted to early childhood. These molecules temporarily force that critical period back open within the nucleus accumbens, the center of the brain's reward and habit circuitry. This sudden fluidity allows the brain to loosen the overtrained habit circuit and route information through new alternative pathways. The drug does not chemically delete the addiction. It acts as a system-wide signal that makes a rigid adult brain teachable again. The evidence is striking, but the ledger is not entirely clean. The 80% smoking figure comes from a tiny pilot study. Rigorous double-blind trials show a significant but partial benefit, and the most potent compounds carry severe risks. Ibogaine, an alkaloid from the West African iboga shrub, can collapse acute opioid withdrawal in roughly 76 hours, but it is also dangerous. Ibogaine blocks a cardiac potassium channel, prolonging the heart's electrical cycle. This can cause fatal arrhythmias, especially without medical monitoring. The biological mechanism of plasticity is real, but it is a volatile tool. These are medical interventions that require strict oversight, not simple cures. There is a final paradox in the data. The presence of the drug alone does not guarantee a patient will quit. The people who achieve long-term sobriety are specifically those who report the deepest subjective experiences during the session. This mystical experience, marked by a sense of unity and a profound reckoning with personal leaning, is the strongest predictor of clinical success. In this field, the intensity of the conscious experience is what determines the medical efficacy. Reopening a plasticity window in the brain is useless if you do not supply a new lesson while it is open. This is why therapy is the active ingredient. The preparation and integration sessions act as the new information being etched into a newly malleable brain. The molecule provides the plasticity. The psychological reframing is the new lesson that takes root in the brain. Psychedelics do not cure addiction. They give an overtrained brain the temporary grace to learn a new way to live, provided there is a guide there to teach it.